Good afternoon, everyone, and welcome to the Town Pediatrics Summer Newborn Expo. My name is Gabby, and I am your host for the week. We are going to be going live every day at noon Central Time with a different Town Pediatrician, talking about an array of topics as it relates to you, your pregnancy, and your newborn. So thank you for tuning in, and if you are interested in winning a newborn bundle from Town Common Sense Parenting, go ahead and leave a comment below and like this video. We're joined today with Dr. Caitlin Gillespie. Dr. Gillespie, how are you doing?
I'm good. How are you, Gabby?
Good. It's great to have you back. I know you were with us in our January Newborn Expo, so it's wonderful to have you again. We are going to be talking about an honest Q&A for pregnant and new moms. So all of the questions that you might be a little nervous to ask, we're going to go ahead and go through those today, and hopefully they can help you out. So we'll hop right into these questions as we get going. If you have questions for Dr. Gillespie, go ahead and comment them below, and we'll get them answered. Okay, so the first question is, when should I expect to start gaining weight while pregnant? Does most of the weight gain happen towards the end, or will I gain any in the first and second trimester?
Yeah, I feel like this is commonly a question. So when Gabby and I were going through these, I feel like there were a lot of pregnancy-related questions, which totally make sense, especially as we're expecting a new baby. And if the baby's not here yet, what we're dealing with right now is pregnancy stuff. And so I think the biggest thing to know is just there is a huge variation in what people will experience in their specific pregnancies, and not even necessarily the same from one pregnancy to the next. So just knowing that there is a lot of difference from person to person in what you experience and what your pregnancy looks like is normal, and that's okay. And I feel like sometimes those are where those questions come from of, well, I know so-and-so who's pregnant and this is not what's happening with them, but this is what's happening with me. Is it normal? For the most part, that answer is probably yes. But if there are things that you're concerned about, definitely talking about it with your OB during your routine visits is the prime thing to do. And I find it, so as a person who has been pregnant before, and actually, I don't know if Gabby even knows this, I'm currently pregnant. So
congrats.
November. So this is near and dear to my heart right now as someone who's doing this currently. But any of those questions that come up, I feel like it's really easy to get to the office and not remember exactly what your questions were. And so if you have any kind of tracking app or notes app where you can put those in there so you can talk with your provider about things, super helpful to remember those things so that you can get your questions answered when you're there. Because sometimes I feel like you're there and things happen and then it's time to go and you're like, oh man, I totally forgot to ask these things. So in terms of the weight gain, usually there's not a lot of weight gain within the first or second trimester. That sort of depends on the symptoms that you're having. So for moms who are having significant nausea, vomiting, those kinds of things, you might even see a little bit of loss in the first trimester, which can be normal. We just want to make sure that we're monitoring that closely, especially if we have symptoms consistent with dehydration from vomiting or just not being able to tolerate food and liquid. But you can have gain. I think one of the important things to remember when you're looking at your kind of weight gain timeline is it's not often a specific like trajectory up. A lot of times it's a stepwise gain. So you might see a gain at one appointment and then you're stable at the next one and then stable and then a gain. So it's not consistent over the course of the pregnancy. When you look at it over time, it will be kind of a consistent trend upward, but it's more of a stepwise fashion than it is a gradual incline. So that's an important thing to remember if we do have an appointment where we're like, oh my gosh, I gained 5 pounds since the last one. Well, at the next one, you might not gain anything. There are different times during pregnancy that we have gained depending on what the nutrient demands of our body are and what we're kind of working on in that part of the pregnancy. So yes, you might see gain during first and second trimester. You might not. You might actually see loss, and that might be normal as long as we're monitoring it closely. You typically will see more of a gain for the end of the second trimester and third trimester. And a lot of that is as baby is gaining weight too, because early on, you're working more towards kind of your own blood supply, placental growth, those things, and so much how your baby is gaining. And then later on in pregnancy, it's really weight gain that's going towards baby and baby's growth and that kind of growth. So it's a little bit different. But yes, stepwise approach, a lot of differences and variation in what you'll look like over time. What you can expect, and most of you with your OB have probably talked about this, but is 20 to 25% or 20 to 25 pounds of weight gain if you're starting out at a normal BMI for your pregnancy. And anything on top of that is typically extra weight that we've put on from just other environmental things. So if we are seeing that 20 to 25 pounds is what we see from, increased blood flow and placenta growth and development and the baby itself and our uterus and all of that. And then anything on top of that is extra.
Yeah. That's great to know. I forgot to mention this at the beginning, so I'm going to throw it in now. We are also doing in-person meet and greets. So if you're pregnant or expecting and you want to meet with Dr. Gillespie or any other of our wonderful pediatricians, that is happening this Wednesday, July 20th from 6 to 8 p.m. So the link is above to sign up for a slot, and we'll also put it in the comments. So we'd love to meet you in person. I wanted to throw that in.
Perfect.
The next question is it normal for my breasts to feel uncomfortable during pregnancy?
Yes. So this is a common one. Again, not one size fits all. And this will be the answer for most of these things. Not all symptoms happen to all pregnant people. Some pregnant women have very few symptoms. Some have a couple that are pretty significant. Some have all of them. And whether or not they're significant kind of depends on different factors. For breast tenderness, both breast tissue and for nipples, I feel like that is a common thing that you see just related to hormone changes during pregnancy. When you're talking about discomfort in terms of like they feel bigger, they feel swollen, that's very common, especially as pregnancy kind of progresses. More of like the tenderness is usually related to progesterone, which is more early in pregnancy. And then the swelling and tenderness can be because, especially if your body is responding to those hormones, you might actually have a change in your breast size well before you actually deliver. And that's your breast kind of preparing for extra milk production, increasing glandular tissue and things like that. So it is pretty common.
Okay. So if I'm currently pregnant and I have low libido, is that pretty normal? And when will it come back?
That is a great question. I feel like that's a very common symptom that people have, though there's a huge spectrum of that. Some women will say low libido, some will say super high libido. It just kind of depends on who you are related to those hormone changes and how your body's processing them. So very normal to have it be lower than maybe what you were used to before pregnancy. When will it come back? Great question. Sometimes I feel like some studies or with hormone changes, you see more of an increase during third trimester. Not everyone sees that. And a lot of times you'll see things decrease again after delivery because there are significant hormone changes that happen after you deliver your baby. So if it's a consistent concern, especially throughout pregnancy and after delivery, I think that's when we're talking more with OBs about, are there other tests that we need to do? Because there are a lot of hormone changes that happen that aren't necessarily related specifically to pregnancy with like estrogen and progesterone, but with thyroid hormone and other things that can definitely affect our mood and our libido.
Good. The next question is, what does spotting mean while pregnant? Is it normal to spot a little bit, or when should I see my OBGYN?
Yeah, I think this is another common question. So spotting is definitely a normal thing that happens during pregnancy. There are a lot of different reasons why. And I think what that really comes down to in terms of when should I be concerned is the amount. So either the frequency that's happening or the amount of blood that you're seeing when you're spotting. You can see different changes in spotting based as pregnancy goes along on if you have like a hematoma or a clot of some kind that's associated with kind of like the baby's sac that they're growing in. Sometimes, depending on pregnancy progressing, you can see that your placenta or part of your placenta is actually over the opening of your cervix. So you can see extra bleeding there. And then there's just some common spotting with just hormone changes as well. So if there is some spotting, especially if it's not bright red blood, that's fairly normal. There is a lot of changes in your vaginal pH with other discharge and things as well. But if you're ever concerned about it, you should be talking with your OB-GYN because they might want to do additional testing or even just reassurance to make sure things look okay.
Yeah, always better to check for sure.
Absolutely.
So we've talked a little bit about hormonal changes, but could we talk about it just a little bit more? Because, sometimes when you're pregnant, you feel great. And then other times you feel so irritable and you just want to so looking for advice on that.
Yeah, I feel like that's one of the harder parts of pregnancy too, is just how you're up and down and things are changing and sometimes feeling great, sometimes not feeling great. And for some moms during pregnancy, especially in that first trimester, you're never feeling great, and that can wear on you too. And if you are feeling great, not usually a cause for concern either. I've definitely had moms that are like, oh, I'm not having any of these symptoms. Is that something to be concerned about? Not necessarily. Pregnancy is very different for all kinds of people. In terms of irritability, I think that is really hard, especially as sleep changes are usually affecting some of that. So you're not getting great sleep, or you're super tired and you just want to sleep all of the time. So both of those things can make you feel pretty irritable, in addition to just the hormones in general. There's not a magic trick to fixing it. And there are certain things and symptoms that are causing you to be irritable. Talking with your provider about different things we can do to manage nausea or vomiting if that's really troublesome for you, especially in the first trimester, can be helpful. Or if there's specific symptoms that are making you irritable, talking with your provider. In terms of your partner or your family members or your friends, I think just being honest with them as you can about like, hey, listen, because a lot of those things are happening internally and happening to you, but other people don't necessarily process them with you. And so you're kind of doing it all by yourself, and maybe they don't realize how tired or uncomfortable or sick you're feeling. And so just letting them know, hey, I'm not feeling my best today. I need this extra time, or I need this extra help, and really communicating that with the people that are close to you. I think that can be really hard, especially early in pregnancy too, because a lot of times you're not sharing with other people. And so it's just kind of you by yourself processing through these different things. And so that can be kind of isolating, which I completely understand too. But I think it's important to, as we feel comfortable with the people that are close to us, letting them know what's going on with us so they can give us assistance as well, or just give us a break if we need it, if they're asking of us.
Yeah, definitely. So we've got a couple questions here in the comments. Thanks everyone for leaving them. Continue to leave them and we'll answer them throughout as they relate. While we're on the topic of low libido, this person says that they were having a little bit of contractions during pregnancy, and that was making them, a little nervous on participating in those activities with their husband. So is that safe? Should she ask her OB? What would you say?
Yeah, I mean, certainly they're depending on the kind of contractions, so like Braxton Hicks contractions are pretty common, just the uterus preparing to deliver the baby. And those can happen kind of throughout, a lot of times second and third trimester. Some people don't notice them at all. Some people are like, ooh, I really notice that. And it's more just like this tensing hardness of my muscle that I notice. And for some people, they are uncomfortable. So it just kind of depends. A lot of times, I mean, if there's ever a concern and you're worried about it, I would talk with your provider. But a lot of times those simple kind of like Braxton Hicks contractions are pretty normal, especially if they're not progressing. If there's ever a time when you are noticing contractions and you feel like they're happening and it's recurrent, or it's happening at more frequent intervals, you definitely want to be talking with your provider about that. Usually sex during pregnancy is not a contraindication for like preterm labor or anything like that. But it's something to consider if you're having regular or frequent contractions.
Okay. Perfect. Okay, so we're going to talk more into, we've talked a lot about it within the pregnancy. Now we're kind of going to go into afterwards, talking about the baby, things with the baby. So if you have any remaining questions on, is this normal during pregnancy, go ahead and comment those and we can always come back to them at the end. You're doing a great job answering them. Thank you for being so detail oriented.
Oh, sure. I'm living it right now. So
yeah. Gosh, guys, no better advice than from a pediatrician who is.
I know. I was thinking about that earlier. I was like, I don't even know if Gabby knows.
Yeah, I love it. Okay, so we're talking about newborn appearance after birth. When babies are born, they all look different, but there are some things that, might shock mom and dad that maybe we can just clear up right away. So if, my baby was born with swollen nipples, breasts, and genitals, why would that be?
Yeah. So, and just kind of looking at these are a lot of routine things that we see asked about, especially in that kind of right in the hospital after delivery, or when we're at our hospital check, which is usually 3 to 5 days after we discharge from the hospital, depending on risk factors. So we get these questions a lot, and a lot of them are very normal things.
Yeah.
In terms of the swollen nipples, breasts, genitals, a lot of that is usually female infants over male infants, though it's definitely possible to see that in male infants too. Most of that is related to maternal hormones and maternal hormone withdrawal. So when we talk about just like generalized kind of breast swelling or the labia looking more swollen, those are things that will reduce over time in those couple of weeks after delivery. Sometimes we do see continued more like kind of like just nipple tissue, usually more in female babies, but not something to be concerned about. And we continue to watch it to make sure everything looks normal. The other one that I think is very common for baby girls kind of related to this is like blood or discharge coming out of their vagina after birth. That is also related to maternal hormone withdrawal. So there's not an infection. Typically, it's kind of like a white, thicker discharge, usually, or sometimes even bleeding. And that is related to withdrawal from mom's hormones after being born. So that is a normal thing we see that definitely can freak parents out. The other thing, this wasn't on the list, but is kind of related, is you might see a little bit of like reddish orange discoloration in a diaper that almost looks like blood in the urine.
Okay.
It's definitely something to note, but it's typically a normal finding that we see in the couple of days after birth. It's called brick dust urine. It's just kind of a sedimentary thing that happens with baby being born and moving things through their system. So that certainly can freak parents out too. They're like, I think there's blood in this diaper. And then you look at it and it's kind of like, that's probably brick dust urine. So a lot of things that are very weird to see in the couple of days right after birth, but very normal.
Yeah, it's good. That's why we're talking about it now, so you're not scared. Yeah.
Yeah.
Okay, so
If you're scared, you just tell us, and then we talk through it and we decide, is this normal or is this not normal?
Totally.
Yeah.
The next one is when baby is born, if their head is elongated or cone-shaped after a vaginal delivery. I know a lot of moms are kind of worried about this, and will my baby have to wear a helmet? Can we talk about that?
Yes. So a lot of that kind of, we call that molding. So the more like cone-shaped elongation of the head right after delivery. Very common, especially with a vaginal delivery. You can see it after C-section, especially if you were actively laboring before you went to C-section, because what that is baby's head being engaged in your pelvis. The reason it is able to do that is we have those different soft spots in the head called fontanelles, so openings that allow the skull to be easily kind of moved to get through that birth canal. So that's why it's able to do that, because we want the head to be able to come through the birth canal safely with a little bit of pliability. And so usually some babies have really significant molding, some have just a little bit. That usually resolves within the couple of days after birth. It's definitely something we keep an eye on, but it's not a risk factor for change in head shape going forward or something that requires long-term management. It's usually just kind of a thing that we see in those couple of days after birth. The other thing that's, I saw another question that was kind of related to this was like facial puffiness or bruising after delivery. And that facial puffiness sometimes is truly like limited to the face. Sometimes it's the scalp where it almost feels spongy. Those are things that we keep an eye on in the newborn nursery, because all of those are based off of baby engaging in the pelvis and kind of what they were rubbing against when they were coming through the birth canal. So mom's pelvis is kind of a bony structure and the head comes through there, and we might get, a little bit of bruising or puffiness or abrasion in an area that was being pushed through that canal. Again, those are things depending on how we were engaged in the pelvis. So some babies have more of like their face that was doing that. Some it's more the back of the head. It just kind of depends on how they're positioned. Mm-hmm. But most of those things resolve within the couple of days after birth. If there's significant bruising, it might take a little bit longer.
Okay.
But nothing that should be long-term concerns.
So then going into, we have a couple questions about baby's eyes. So my newborn has blood red on the whites of their eyes after birth, or my baby keeps crossing their eyes.
Mm-hmm. So the blood red, so that it's called conjunctival hemorrhage, is similar to the other things we just talked about in terms of birth canal. So coming through, there's a lot of pressure, a lot of pushing. Sometimes we can have rupture of those blood vessels in the eyes that then make it look red all the way across the white of the eye. That's fairly common during delivery with vaginal delivery. It's not something that's uncommonly seen. So that's another one of those things that it takes a little bit more time to resolve, just because that blood needs to be resorbed, but not something dangerous or that should cause long-term complications. So that is something you'll see with babies after vaginal delivery. In terms of crossing their eyes, babies are kind of working through processing vision and eye muscles, a lot of times what parents will notice is, especially when they seem to be looking at you or looking like trying to look across a room, that they're crossing their eyes. Fairly common, and usually the reason why they're doing is they're just working on those accommodation skills. Babies, when they're first born, can see about with you holding them in their arms, they can see about that far. So your face essentially. And even that is more like shades of gray, white, and black. A lot of parents will notice as babies are getting older that they focus on the fan or the ceiling fan in the room or like lights. And it's because they can differentiate light and dark. They can see those high contrast things much easier than other things. And everything else is them kind of working through the process of getting their eyes to move together to accommodate, but they're not able to do that right after birth. So that is a lot of times why you see their eyes crossing intermittently. We give that usually a couple of months of time. That usually is not a concern by 3 to 4 months of age. And if we do see that, then we're referring to the eye doctor to just monitor for either in-turning or out-turning of the eye. As when that happens longer term, it can cause more long-term vision complications. For the most part, we see that completely resolve and it's not a problem. Very normal for just newborn accommodation with the eyes.
Great. Newborn breathing patterns. So sometimes my baby will breathe really, really fast. Is that normal? When should I be concerned about that?
Yes, babies' breathing patterns do all kinds of kind of crazy things. That kind of really fast and then taking a pause and then breathing really fast again after to catch up almost is called periodic breathing, very common in the newborn period. What you want to be worried about is if we have continued fast rates of breathing. And for babies, they do breathe pretty fast. It's fairly normal for babies to breathe anywhere between like 40 and 50 times a minute. It's usually when it's greater than 60 times a minute that we're really like, okay, that's pretty fast. And that might happen for a short period of time, but should not be happening for a prolonged period of time. So we do see those periodic changes where baby will seem like they're not breathing at all and then breathe really fast to catch up and then be breathing normally. That is normal. Concerning would be breathing more than 60 times a minute consistently, where they continue to do that, or any other signs of respiratory distress. So for a little one, that looks like their little nose is flaring, so their nostrils come in and out. When you're looking at their ribs as they're breathing, the skin in between the ribs is sucking in or below the ribs is sucking in. It is fairly common for babies to breathe with their bellies too. So you might see them belly breathing. That's not as concerning, but you want to keep an eye on that too. So those would be things that are more concerning for true respiratory distress, that along with any significant color changes. And so color changes, I guess, is something we want to touch on too. It is not uncommon for babies to have more of a blue or purple discoloration of their hands and feet, called acrocyanosis, right after delivery. But it can last a little bit longer than that, as long as it's just like kind of the distal extremities. It shouldn't be central, and it shouldn't be their lips or their mucous membranes. So color changes in those areas are also concerning.
Okay. And then one more question on breathing. If we can see bulging on baby's soft spot when they breathe, is that normal? And could you maybe describe what the soft spot would be?
Yeah, absolutely. So that can be normal. So we have two, but the main one that parents can see is this one kind of right here called the anterior fontanelle on the top of the head. This is something that closes over time, usually by the end of the first year of life. But when we're little, we can see that kind of changing with position and pressure changes. So sometimes a little bit more tense or full as we're like sitting upright, maybe a little bit less. It just kind of depends. In terms of breathing, because we have those variations in pressure related to breathing, we can see it change. The main indication for looking at the soft spot is if for any reason it's very low or sunken, that's concerning for dehydration or just low volume within the body. If it's ever bulging, so if you look at that spot and it's tense and kind of sticking up or anything, that's concerned for high pressure in the head. Those are just two different things that we would consider. If it moves a little bit while we're breathing, that is normal. But if it's sunken or if it's very full, those are things we want to be talking with your pediatrician about.
Okay. Great. So we've talked about, is this normal related to what our baby looks like after birth? We're going to go more into the postpartum experience here for moms. But before we do that, I want to remind everyone to like this video and leave a comment below and let us know what you're looking forward to this week for our Newborn Expo for a chance to win a newborn bundle from Boys Town Common Sense Parenting. Okay, so This one, this question relates. We are actually doing a whole live on this topic on Wednesday about bonding with your baby, and that is more for the non gestational partner. But for this purpose, talking with moms especially, can we talk more about, if I'm having a hard time bonding with my baby, right when they're born, I thought I would feel like all these things, and I might not be feeling like I thought I would. Is that normal?
Yeah, I feel like that's a common question or concern that kind of ties into with a similar topic that we're going to be talking about, which is kind of baby blues, postpartum depression, those kinds of things. So having difficulty bonding with baby doesn't necessarily mean that, but it's certainly something to consider in terms of your mood, because that is something that can definitely affect your ability to bond with your baby if you are having significant mood changes after delivery. The other thing that's hard right after baby is born is it's a fairly high stress time. We're not getting a lot of sleep. It's just a hard time on our body and our mental health, all of those things. And then on top of that, it's very normal to not have baby be able to interact with you kind of like you might expect your baby to be able to interact with you right away. So it takes time for baby to be able to really see and recognize your face and your voice. It takes time for baby to track what you're doing around the room, to smile at you, to giggle at you. And I feel like those are things that often help when you feel like, oh, yeah, like baby knows it's me, to help you bond. But those things take time and that is normal. So if you're not seeing those things from your baby, that can be stressful, I think, especially for first time parents if you're not used to what normal development looks like. But it is not uncommon for babies to not start to smile or kind of react to you as a parent for the first 4 to 8 weeks of life. So that can be really hard to bond when all you're doing is, addressing crying and feeding and diapering and sleeping, and you're not getting sleep and you're not feeling your best. So that is a common thing to feel, but we also want to be thinking about that in terms of baby blues and then that kind of difference between baby blues and postpartum depression as well.
Mm-hmm. Yeah, and that's actually my next question was, what is the baby blues and how is it different from PPD and when should we be seeking more help for that?
Yeah. And those are really good questions. I think we talked about these when we did our kind of like postpartum thing in the winter time too.
Yeah.
But super important. So really that postpartum period, we were talking about baby blues versus postpartum depression. Postpartum period is technically the first 12 months after birth. So a long period of time where you're going through a lot of changes, both you and the baby together, those different changes can sometimes be affecting our mood. It's not necessarily right after birth and delivery. It can be in those months following up to that first year of life. The highest risk is in those first couple of weeks. And that's why we're keeping an extra close eye, because we just have so many hormonal changes that are happening after delivery. So technically, postpartum blues are those kind of mild, transient symptoms. We're very emotional. Insomnia is common, or difficulty sleeping, decreased concentration, which is kind of related to the mood changes, but also to the fatigue that comes with having a newborn. Those are the symptoms you see typically within the first couple of days of delivery. They'll peak usually within that first week around day 5 to 7 and resolve within 2 weeks of onset. And so there have been multiple studies that show that about 40% of women experience these symptoms after delivery. So almost half of them. So fairly common, but they can still be something that's problematic in our kind of postpartum recovery and making sure that we're monitoring.
Yeah.
In terms of the transition between kind of the blues and postpartum depression, the criteria for diagnosis of true postpartum depression are the same as the criteria that are used for non-birth related depression. So 5 or more symptoms that would be consistent with depression over a 2-week period that are causing either distress to the person feeling them or impairment in what they're able to do. And so those kind of symptoms would be like a consistent depressive mood, diminished interest in your normal activities, difficulty sleeping or sleeping too much, fatigue, loss of energy, inability to focus. And then the most important one is any thoughts about wanting to harm yourself, harm others, or thoughts of death or wanting to hurt yourself. So we usually think about these things in terms of, postpartum depression, but postpartum anxiety, PTSD, and psychosis are also possible following that period after delivery. So with those, especially if we had any specific stressful experience related to pregnancy or delivery or the postpartum period. So those are things to keep an eye out for. It's not always depressive symptoms. It might be these other types of symptoms related to anxiety or PTSD as well. And the prevalence of postpartum depression for the general population of kind of like Europe and United States is about 10%. So 1 in 10 moms will have clinically diagnosed postpartum depression. So a decent amount of people, and something we definitely want to be aware of. In terms of risks, it's important to identify the risks that you might have of being at increased risk for developing that after you've delivered. And the most significant is any past history or prenatal history of non-perinatal depression. So if you have a history of depression, you're more likely to have significant postpartum mood changes or depression. So there are lots of risk factors. The main point is just identifying what yours are. And if you have several, many, it puts you at a higher risk for developing that after you deliver your baby. I think one of the most important things in terms of identifying your mood changes, and if they are consistent with a true diagnosis of postpartum depression, are just kind of education and then honest communication with your support people. So discussing what those mood changes look like after delivery, letting people know if you're struggling, and encouraging them to be honest with you if they notice that you're struggling. So your partner, your family members, anyone who's going to be supporting you after delivery, to say, hey, this is going to be a hard time for me. And if you notice these things or are concerned, let me know, or please reach out because we want to get you the resources that you need. Another I think highlight to this, for most first-time moms, you're going to be following up with your provider, your OB provider, or your midwife or whoever, usually sooner than the 6-week period, which is normal for subsequent deliveries. It's usually around the 2-week period. But it's also important to communicate these things with your provider because they might want to see you sooner than they had originally planned to discuss symptoms if you're noticing these things before you're due to follow up with them. In terms of screening, both your OB provider and your pediatrician will start screening at around that 2-week visit. So we routinely do that in our Boys Town offices as well, just because we typically in those first couple of months of life see you far more than your OB care provider will. We just have a lot of follow-up for the newborn growth and development period. So if you're not being screened, request that you do be screened, and we just want to make sure you're getting resources that you need, whether that's counseling or other resources, or following up with your provider for medications if that's what's indicated.
Yeah. And I'll make sure to everyone to link below in the comment section the live we did with Dr. Gillespie that goes even more in depth on, the postpartum experience and self-care as it relates to baby blues and PPD, things like that. So if you're interested in hearing more about that topic, I'll go ahead and link that below. We have a couple more questions, so I know there's some hanging out in the comments. I'll make sure to get to those. And if you have any last minute questions you want to add, please comment them now so we can get them answered in time. Okay, so this one's kind of along similar lines. When will I start feeling more like myself after giving birth? I feel like a total stranger in my own body, and that can relate to, the weight gain or the hormonal changes, just not feeling like myself. And when can I expect that to lighten up?
Yeah, and I feel like that's one of the most common questions for after delivery is, how long does this take? And the frustrating answer, and similar to what we've heard from other pregnancy things, is it's not a one size fits all. It definitely depends on the person. It depends on a lot of different circumstances and variables. So it can be a challenge to process all of that as a new mom because you've got a new baby and you've got these other things that you're doing. And in addition to that, you feel like you're just not in control of your own body at all. So kind of like Gabby said, whether that's weight change or breast changes or skin changes, hair loss, which is one that usually occurs sometime around 4 months after delivery. So kind of when you maybe feel like you are coming back into your own a little bit. Yeah. I feel like if it's going to happen, it's usually after that, what we call the 4th trimester. So that one can kind of take you by surprise of like, whoa, what is this? But there are a lot of those things that just kind of change that are very common during pregnancy and in the postpartum period. So there's, again, not a quick fix or a magic remedy to that, but I think giving yourself grace is one of the most important parts. So it took your body 9 months to make this baby and deliver this baby, and it's going to take time for things to transition back. And there's a good likelihood that things will never go back to how they were exactly before, and that's okay. I feel like it's important to say that's especially true for breastfeeding moms. Some moms notice that their weight comes off really quickly after they deliver the baby, but for some breastfeeding moms, it might be the opposite. You might notice you actually gain weight while you're breastfeeding. You might notice that your milk supply changes while you're trying to diet and calorie restrict. It's normal, but it can be really frustrating. So we just have to kind of give ourselves grace to work through things as time is going to allow us to. One thing that I found really helpful was finding clothes that make you feel good. That doesn't mean it has to be fancy or anything. It might be fresh, comfy clothes for all the time you're spending at home, good nursing bras, really nice sweatpants, a fluffy robe, anything that feels comfortable while you're at home. And then anything that you do want to wear, like out and about, treat yourself to something that makes you feel good when you have it on if you're going to be out and about. Because it can be stressful to put your old clothes on and see and feel they just don't feel right or they feel different. And that's okay. We don't have to get rid of them. We just don't maybe wear them for a little bit of time and find stuff that makes us feel good in our own skin. So it's hard in terms of the body changes. And then the other thing is kind of like Gabby said, we did a longer presentation on this in the winter time, but just self-care stuff. And that looks different depending on who you are and kind of your interests. I feel like one of the biggest self-care things for kind of feeling like you're not a stranger to your body or feeling good about yourself is prioritizing your sleep. We talked about that a lot, I think, in that last talk, but the sleep changes and the deficits for new parents take a toll on both your physical and your mental health. It's super easy to think that you can just get things done while baby is sleeping so that you're on top of it, but really prioritizing your sleep is important to make sure you're feeling and doing your best. We just have the newborn sleep schedule is very different from any other sleep schedule that we've experienced previously. They sleep a lot, but not in any pattern that is typically restful for a parent. So we just learn to accommodate that and really focus on getting our sleep in. I think that's one of the biggest things, especially in that first 2 to 4 weeks after delivery. We also talked about open communication for kind of getting back into your own, just asking for help when you need it. So that open communication piece with any of your support people, so partner, family members, friends, letting people know you're struggling or that you need extra time for yourself so you can feel more like yourself, to do some of those self-care measures. Now, like we said, that might be different, whether that's pampering and you just need to do something like taking a long hot shower or a face mask or an appointment for something, like that is totally fine. Also just anything that re-energizes you. So if it's spending time doing a hobby that you like, reading, binging a Netflix show, who knows, getting out of the house for a little bit alone, anything that refreshes you and refills your cup so that you can feel more like yourself. I think one of the other ones that's really important is just focusing on your nutrition and fluid intake. It's very easy for moms, especially in those couple of weeks after delivery, to kind of neglect those things. And your body is recovering from a significant physical experience. And you just need to make sure that you're nourishing yourself as well to make sure you feel your best self. So in terms of most moms, you're going to need 2 to 3 liters of water a day, and then making sure you're getting as much nutritious stuff as you can, healthy fats, anything like that, in terms of just high calorie stuff that's going to help you feel better. So like we said, you feel like a stranger in your body. You might feel like you want to lose weight. A lot of times it's not the time to start a diet. You just need to listen to your body. If you're hungry, eat and give yourself time to recover. A lot of those things are hard to kind of make that transition right after delivery, but important to just give yourself grace to let your body recover from all the work that it's just put in having your new baby.
Yes, thank you. And yes, someone asked how to access the Winter Newborn Expo. They're all saved as videos on our Facebook page, so I'll go ahead and link the event to that after this presentation concludes in the comments here, and then you can go back and watch them. We did 5 days of lives just like we did this time. Okay, so let's go into some of these user comments here. Is it best to do skin to skin immediately after baby is born for an hour and then have them clean the baby up?
So a lot of times if we can, if medically it is indicated that we can take that extra time to just bond with the baby skin to skin and do that first breastfeeding, absolutely. A lot of times what you'll see is you'll have baby either just like wrapped or cleaned up a little bit and then brought to you before they're doing any of the kind of other normal things that we would do as part of normal newborn care. So the goal, and most hospitals are great at following this, is that we have baby skin to skin as soon as possible to initiate first breastfeeding, called the golden hour. So we take that hour right after delivery and have mom and baby and partner, whoever else is there, all kind of together, and just focusing on that before we're doing really any of like the other medical things that aren't acutely necessary. Now, there are times when that happens where maybe we've had baby not tolerating delivery well, or other things where we need to, assess baby away from mom for a little bit. Usually that happens right there in the room. There's all of the things that we need in order to look at a baby right there near the bedside. That sometimes happens. And if everything looks okay, we bring baby back over. And if things are not looking okay, then maybe we transition that plan of care. But the goal would be to have baby skin to skin with mom and feeding in that whole first hour after delivery.
This one is about we got questions on hiccups and burping. So my baby gets hiccups very often. Is that normal?
Yes, I was laughing because I just talked with someone in clinic about that, like right before this. So yes, hiccups. The other common ones are like yawning, sneezing, all very normal. Hiccups specifically, and a lot of what you'll see in terms of just kind of weird things that babies do are just neurologic immaturity. So babies are born, but they still continue to grow and develop significantly, especially in what we call that fourth trimester. So those first 12 weeks after delivery, really, I mean, for the first couple of years of life, which is why you're following up with your pediatrician so frequently, is there's just a lot changing in that period of time. The hiccups are one where we have a nerve that connects to that big muscle underneath our lungs. And so that kind of immaturity is a little bit hypersensitive at times and might cause those hiccuping. They're generally not dangerous. If you had a baby that hiccuped in your belly a lot, they're probably going to hiccup on the outside a lot. I found that.
Yeah.
I don't know why that is, but not dangerous. Some parents, their question is also can we feed through hiccups? You can. If they can't tolerate it and the hiccups are so forceful that they're like popping off and, can't hold the bottle, then that's fine to take a break. And just let them kind of resolve. But you can try feeding through them. Sometimes that'll help them resolve too.
Mm-hmm. And then a follow-up is it normal if my baby has a hard time burping?
Yes. And we were just talking about this too. So in terms of burping, it's difficult a lot of times for a first-time parent. We're not burping them. We're not using enough force when we're trying to do it because they're so little and we don't want to hurt them. But very common that we're not using enough force to get that burp out. So whether that's sometimes positioning wise, you want to have baby like sitting upright and you're supporting their neck and head like this way. And then padding, that can help force the burp out. You can also do it on your shoulder if that's more comfortable. But a lot of times we're either wanting to use like this part of our hand or this part of our hand and really like giving them a good thrust. And usually when we're doing that, we want like a blanket or something in between just so we're not right on their skin. But a lot of times you need to be firmer than you think you need to be in order to get a successful burp. There are going to be times that baby doesn't burp, and that's okay. Some babies are very gassy and need to be burped multiple times a feed. Like we should burp them in the middle. We should burp them at the end. We should give them a little chance and try and burp again. Some babies don't have a lot of issues with burping. And if they're not overly gassy and they're not having issues with spitting, it's generally not a big concern. It just kind of depends, but it is kind of hard to get that figured out in terms of getting your baby burped adequately, especially if they're gassy. The other thing with gassiness is that is a very common newborn finding, again, related to just neurologic immaturity between our brain and our tummy and our gut and our booty. Like they're just not good at coordinating all of that together. And that's very normal. Typically, parents get concerned if we're having a lot of gas problems and we're really red in the face and we're grunting and we look uncomfortable, but we're not constipated and we're pooping fine. A lot of that is related to babies not knowing that they need to relax their little booty so that they can toot or poop. And so sometimes helping them with stimulation there, with even if that's just like a wet washcloth or just you're wiping. A lot of times you'll notice your baby poops right after you change their diaper. It's because we just stimulated the area they needed to poop.
Yeah.
That helps them. There are products that can help with that, like the Windy from Mom Frida. If you want to use that, you can. I never used one. I don't think it's necessary. We definitely don't have to be doing it all the time. But those are things that we see that we're like, oh no, they seem like they're really in pain or they're really uncomfortable. It's essentially that they're trying to tube, but they don't know they need to relax their butt to do it. And so they're just like working really hard to do something because they're not good at coordinating it.
Yeah. Awesome. Well, we are just about at time. So if you have a question that was not answered, or if you're watching this later, because this video is saved on our page as a video and it'll be on YouTube, if you have a question for Dr. Gillespie that we didn't answer, go ahead and comment it and I will make sure to facilitate and get that answer to help you out. So tomorrow we're going to be live with Dr. Annie Zimmer at noon for the topic of breastfeeding, which is always a very popular one. So make sure you tune in for that and tune in the rest of the week. We've got, like I mentioned, bonding with baby. We have newborn travel tips. We're having one on preparing to go back to work after you've given birth, stay at home mom's toolkit. So many good topics. So love to have you join for those. And tonight at 6, we have Dr. Sarah Orr. She is going to be talking about how to choose a pediatrician. So things to keep in mind for you and your family. And I want to remind everyone again one more time that this Wednesday, July 20th, from 6 to 8 p.m., we are doing live in-person meet and greets at our Town Pediatrics clinic. So you can meet Dr. Gillespie or any of our other pediatricians that are participating, but you need to sign up for a slot. So the link is above this video and in the comments below to sign up. So with that, Dr. Gillespie, you are always so fun to talk to. And like I said, you give so many details that are just so needed, especially as we prepare to give birth. So thank you so much. And congrats on your pregnancy.
Yeah, thank you. Sorry for that surprise, but yes,
Love
I'm
it.
happy to join and happy to participate and happy to answer any other questions that people might have too.
Wonderful. Well, thank you, everybody. And we will see you tonight at 6 with Dr. Orr and tomorrow at noon with Dr. Zimmer. So thanks so much. Bye.
Bye.